Estrogen and oral microbiome interact with each other that directly impacts female's biology. And this is very important for perimenopause and menopause women. And let me explain you this why, right? So, our salivary glands have estrogen receptors, and oral microbiome metabolizes certain sex hormones such as estrogen and progesterone, right, which they use for growth factors as a growth factors, or for synthesizing certain nutrients such as vitamin K, right? And so your oral microbiome directly impacts your estrogen level. So when your oral microbiome is imbalanced, it could directly make estrogen level high or low, and that directly impacts the reproductive health and other metabolic health conditions, right? Specifically in case of menopause situations, right? Estrogen level declines, and since estrogen regulates salivary flow, right? So with lower estrogen levels, it directly reduces the salivary flow, it directly impacts the salivary quality. It leads to disruption in the functionality of the oral microbiome. The oral environment loses its immune defense system, and this leads to growth of pathogenic bacteria and even fungi species, right? And when they grow, they express virulence genes that lead to inflammatory cascades inside the body. And female tend to have dry mouth, burning mouth syndrome, they resort to mouth breathing, right? All these have a direct systemic impact on their overall reproductive, oral and systemic health, right? And low estrogen level also leads to breakdown of collagen, right? So we need collagen for maintaining the integrity of the oral tissues, right? So with the breakdown of collagen, there's an overexpression of certain protease such as MMP9, MMP13, right? And this leads to leaky gums, and this allows the oral bacteria to enter the bloodstream and reach to other body organs where they could do systemic inflammation. And since low estrogen level directly impacts the oral microbiome functions, it could lead to functional loss of nitric oxide production, and this could increase the risk for heart disease in menopause women. So that is the reason why female during the menopause phase have a higher risk of heart disease and even type 2 diabetes. So it is very important to understand the role of your oral microbiome.